Ladies and gentlemen, I want to thank you for coming out here this afternoon to the COVID-19 press conference in Beaufort County. The reason we called this conference was to let people understand what COVID-19 is and what it is not. There are a lot of messages out there today that are inaccurate, overstated. We want to make sure that people do have a firm understanding of what to expect, and also to communicate to the public that their elected officials and emergency service people, the hospitals, have been and will continue to be as prepared as they can possibly be for this, to deal with the COVID-19 when it eventually makes its way to Beaufort County, and to alert people how to control it from getting out of hand. We want to keep the incidence level as low as possible so as to not overwhelm the medical services in anywhere, Beaufort County, Craven County, Pitt County. Just from people in general. We want to keep it as controlled as it possibly can be. With that, I'm going to have several of the other members here speak in turn in their areas of professionalism or in their areas of responsibility. We'll start with the Chairman of the County Commission, Commissioner Jerry Evans.
Good afternoon. I would like to make sure we understand that we want to provide as much transparency as we can to the citizens of Beaufort County. So our goal is to make sure that the citizens of Beaufort County have the latest information on the COVID-19 virus as it may affect Beaufort County. We have a link on our Beaufort County website that will go directly to the Beaufort County Health Department website, which contains a lot of good information and about the COVID-19, along with consistent updates that will be provided from the North Carolina website. So again, I'm going to turn it over to the next presenter, but what we're trying to do is make sure all the citizens of Beaufort County are provided with the latest information as we receive it. Thank you.
Okay. How you doing, everyone? Jim Madson, Beaufort County Health Director. In public health, we're always looking at communicable diseases in the community. And as such, early on, we were aware of this, and so our EPI team, which is a group that consists of experts that deal with communicable diseases in the community, to include Vidant, to include the school system, emergency management, as well as people in the health department. We monitored the situation early on. Since early February, we've been on calls every Tuesday with the state epidemiology experts, public health, Department of Public Health. And so we've been following their guidelines and trying to implement those at the county level. And our EPI team is meeting once a week now in order to discuss, strategize, and plan for anything that comes up. And we also have set up a health EOC, which is a little bit different from the county level emergency operating center, and the fact that it is constituted mostly from the health department staff with their expertise in those areas. What we're doing is also setting up a joint information center through that health EOC, and that is where we're going to try to get all the information out to the community that has been vetted so there's not a lot of misinformation that's out there. And then I'd also like to point out that there is a statewide call-in that you can use, 866-462-3821. If any citizens want information, they can call that number, or they can call the health department here and ask those questions as well. Thank you.
Carney Hedgepeth, Beaufort County Emergency Services Director. As Director Madson said, from the health department, this is a health issue in that it is different than the typical disaster response that we have in the past. And with this, the real message we want to continue to send is to be calm and to be prepared. The Emergency Services Division will be standing in more of a logistical role with the health department, supporting them in their needs. And with that, Manager Allen.
Thank you, Carney. Just again to reiterate, from our side, the county is standing in support underneath the health department, with it being a public health emergency. Typically what you see in our normal operations when we stand up an EOC is typically related to weather events. This is a little different example. As they spoke earlier, the health department takes the lead on this, so they've set up the health EOC, which goes through that process and has their people in the right place, and we stand in support of them. So thank you.
Good. Mike Hodges, Mayor of Washington, and I just would like to urge everyone to remember that to be concerned about this virus and pay attention to it and check the website, especially at Beaufort County Health Center and their Facebook page. But please don't panic. Panic is the worst thing that I think you can do, and you know, all this rush on toilet paper and everything is, I can't imagine why we're running out. But anyway, please, you know, try to be concerned and not panic. Thank you.
Hi, my name is Dr. Perrin Jones. I am an anesthesiologist practicing primarily over at Vidant Medical Center in Greenville. I'm also the representative for House District 9, which is in Greenville and Pitt County. I'd like to start off by simply saying thank y'all. Thank you for having me out here today. I always like coming to Washington. If I hadn't eaten lunch before I came over, I'd probably run over to Bill's and maybe get a couple of hot dogs. I have said several times before, and I'm sure that I will continue to say, that COVID-19 or the coronavirus is a cause for concern. It is not a cause for fear and panic. Quite frankly, the fear and panic, if we were to succumb to that, is something that will actually make what is currently a health crisis into a health catastrophe. We can do simple things to help contain and slow the spread of this virus. These are not things that are wholly unheard of to any of us. If we were to simply wash our hands, cover our noses and mouths when we cough and sneeze, try to limit our contact with other people if we're feeling sick. Those simple steps will go a long way to slowing and potentially minimizing the spread of this disease. It is incredibly important that we take these steps at this point in time, because what we would like to do is blunt the incidence of the disease, the spread of the disease, so that we don't end up overwhelming our local healthcare delivery systems as we've seen in northern Italy. So again, please do not succumb to the fear and the panic of this disease. Take simple steps to try to control the spread. Wash your hands, cover your nose and mouth if you cough or sneeze, and follow other practical steps to simply limit the spread of the disease. Thank you.
Thank you all, gentlemen. I also want to add, well, first of all, my name is Keith Kidwell. I am the state representative for the 79th District, which encompasses Beaufort and Craven counties. This morning we had a meeting with the mayors of all of the municipalities in Beaufort County. We also had in emergency services, the Beaufort County Health Department, and management from Beaufort County to make sure that everybody had the assets in place that they require, to make sure that we have a message that is appropriate to the level of what we're facing without going over the top, and that message would be available to all of the elected officials throughout the county and throughout my district. What we want to do is have a clear message that yes, this is something of concern. Very similar to the flu and should be at the same level. There's a lot of panic going on, there's a lot of fear going on because there's a lot of misunderstanding and misinformation. I think that Dr. Jones, Representative Jones, put this very clearly. Very simple things. Wash your hands often. Don't cough or sneeze without covering, preferably into something like a handkerchief along those lines. If you get sick, self-quarantine immediately so that you're not spreading COVID or any other contagion. Stay away from the elderly or infirm if you're sick. And this is common sense at any time that you're ill, not just with COVID. This is with the flu, a cold, or anything else. It's the smart thing to do. Avoid unnecessary group contact. We don't want to say stay home permanently, but right now we want to take a couple extra steps. If you can't get to a sink to wash up, use hand sanitizer. Above all, remain calm. Fear will be more of a problem in this, panic will be more of a problem in this than the actual contagion itself. With that said, we'll step back and take whatever questions you might have. Oh, I do want to add one other thing. Telehealth is available through Vidant 24 hours a day. You can speak to a doctor online. Also, if you need to seek medical attention and you think you've been exposed to COVID, be sure to contact your medical professional first. Make arrangements. They're going to want to do special handling, not have you come and sit in the waiting room. So contact them in advance, and we'll take any questions you have at this time.
With social distancing, I don't know who the best would be to answer this question, but when it comes to that, what would we like to be telling the community members? Because I know, people might not fully understand what social distancing is. It's not, quarantining yourself into your room. So can you explain a little bit on that?
Hopefully I'll answer that question the right way. For social distancing, there's a couple ways to do it. One of them is avoiding the mass gatherings that is being recommended. So that would be one form of social distancing. Another one would be to self-distance yourself from people if you're sick. So when you're sick, don't go to work, don't go to school, stay home until you recover from that. Then you also have people that may have come in contact with it, and typically they're going to be notified by health authority. Usually the health department will, if we know a case, then it will notify you that you've been in contact, and then we would ask you to stay at your house at least for the 14 days, which is what the recommendation is, in order to make sure that you don't actually get sick. And we'll continue to follow up with you, usually on a daily basis with a phone call at least. And then if you were to get sick during that time period, then what we would do is we would change what we're trying to do for you.
I don't know who can answer this, but with the high pollen rate that's coming up and the sinus season, can you tell the difference between a sinus allergy and what we have going on?
That sounds like you.
That's a great question. Actually, right before I came over here, one of my partners had said that he was out on a bike ride yesterday and started noticing his nose was running, looked around and saw the pollen starting to come down. And so I think that's something that we're going to be dealing with and potentially confusing between simple sinus issues that are pretty common for this time of year, as opposed to COVID-19 or some other type of viral illness. I think the big difference is really the presence of fever. I think that's a big differentiator. Usually for simple sinus issues, people don't end up with a fever unless they develop some kind of like a bacterial sinus infection or something along those lines. So the presence of fever, some type of a cough would also be another indicator. And then going on to some of the more serious symptoms like being actually short of breath with activity and things of that nature.
I got one for Jim. Has anybody at this point been tested for COVID-19 in Beaufort County?
Been tested?
Or in the process of being tested?
We've had people tested. Yeah, usually it's based mostly off of symptoms though in this case, and they were negative for the flu, so we did test them, and that result did come back as positive or negative. Negative.
All right.
And I expect with the criteria for testing to increase a lot of testing in the county, and we at the health department will get notified of any positives that do occur, and then of course we would. First thing we'll do is let the public know that we've had a positive in the county, and then we'll follow up, of course, with the patient and make sure that we cover contact list of that person so that we can inform them to self-isolate then for those 14 days and monitor them.
When you're doing these testings, are you doing it at your facility or are you having to send them out?
Well, we collect at the facility, and we send them to the state lab for analysis, and then they'll send it to the CDC for confirmation.
Oh, do any doctor's office or private providers have those tests, or are they all centralized
No.
at the health department?
Providers can now do it at their facilities. More and more kits are being distributed to the providers. And, you know, I would encourage actually most of the providers to do it in their office while they're diagnosing the patient. Since they're with the patient, they've already been there, so they might as well do all the testing. And then we would get information that they did the test. And then we're willing to follow up with anybody that they test to help educate them, insure them, and, you know, to help keep them at that isolation stage, at least until we get the results back for the test.
Yeah, so on the local level, you know, this is definitely going to start impacting local businesses and the economy. So any comments on, you know, any preparations or precautions for business owners or anything like that?
I'll go ahead and take that. So actually at the state level, we'll have 2 conference calls this afternoon in reference to that, so there'll be more information available when we hit the Craven County press conference. But the state is looking at what they need to do. Clearly, we don't want to see a bunch of businesses go bankrupt from this, and there is obviously potential for that. One of the comments I heard early this morning is we may see as many victims in bankruptcy as we do in getting the actual virus, because it can be a big problem. So this is why we want to bring a level of normalcy to the area, to let people understand that while it is a concern, this is not you know, the Black Plague out there, okay? We don't expect to see millions of people falling over dead in the street. There's going to be folks that'll get sick. By and large, the recovery rate is very high. What we are seeing is that the mortality typically is, as we talked earlier, going to be with people who are already compromised or the elderly. In fact, if I remember correctly, and Doctor, you can correct me if I'm wrong, actually in young people under the age of 14, it's almost unnoticeable that they've actually gotten the virus. So it's really something that we want to be careful, but we want to try and carry on life. Go out and, you know, I just came from the restaurant down the road, had no problem going in there. You know, just when you go in, wash your hands. When you get done, wash your hands, okay?
In the case that someone does test positive for COVID-19, what would be the next step there? Are there quarantine procedures in place, or what would that situation look like?
Right now, it's all self-quarantine. You know, that's the recommendation that we're given. They do sign some forms to say they recognize that they need to stay there at home, and the communicable disease nurse at the health department will contact them daily to just check on them to see how they're doing. Some of the positives, though, may be sick and would be put into isolation rooms at the hospital if they were that sick. So we'll be working with the healthcare system to monitor and watch over the person that came up positive. Again, we would also be going through the contact for a few days prior to their symptoms appearing, so that we can notify everybody in their contact trace, so that we can let them know that they need to self-isolate and watch for whether they come up with symptoms or not.
This one's for Mr. Kidwell. What are some of the actions that the General Assembly is taking to make sure that local departments have the resources they need to take care of the situation?
We're encouraging that all of the local departments contact the North Carolina Department of Health and Human Services to make sure that they have the assets in place that they require. So we're working very closely with them, which is part of the meeting we had this morning. We're going to have a conference call for an update, I believe it's in about an hour, to get additional information disseminated down from the state level, and be assured that the North Carolina General Assembly will do what is necessary to make sure the assets are in place across the state to protect the citizens as it's required.
So one thing with this Joint Information Center, and this might be more for our edification than anything else, is there going to be a liaison, so to speak, where businesses can share their information for dissemination with the public? With the two-way street of communication, you've got a lot being put out on social media, a lot being put out on Facebook. It's kind of a scattered information situation.
Right.
How do you see this Joint Information Center kind of funneling that information?
Right. Well, we are, two of the goals of the Joint Information Center will be to strategize on the best way to proceed with passing out information. So we're working on that right now. We've got the website at the health department, which we're trying to use as the central depository of information for people to pull up. Of course, you can like us on Facebook because we're sending out information all the time. So more people would be able to see updates that we send through that way. We have, the experience that emergency management has had in the past with hurricanes. They have a good list of folks to include leadership in the community for us to send information to them, and then they'll be able to distribute that amongst their group of people to try to get out that information as quick as possible. We realize there's a lot of information that's coming from different sites, and so we would just want to be one area where people can get that information and know that we've vetted it just to try to make sure that it's accurate.
Follow up on that, Matthew, would be the State of North Carolina Department of Health and Human Services has a web link. My legislative assistant will be handing out those websites, one for Beaufort County and one for the North Carolina Department of Health and Human Services, along with some samples of the information that's available there. And we'd like to see that information disseminated as much as possible. If the media can get that onto their websites to let folks know what they need to do, what the virus truly is all about, that's going to be an important part of this. You can also find that on my website and my Facebook page. It's repkidwell.com, or on Facebook. I try to put everything out there I'm getting at the state and federal level, and that's going to be Representative Keith Kidwell on Facebook. So.
Now, I know Beaufort County Schools has been meeting and, talking about what the best precautions are to do moving forward. So what would you like to say to parents when it comes to, the school system staying open right now and what steps they're kind of taking, right now?
Brian, you want to take that?
That's probably a Jim question.
Well, for the parents, let me start off with this. We haven't had any cases right now in Beaufort County, so I think at this point the risk is pretty minimal. So we're assessing the situation. We're looking for guidance that comes from the state on recommendations like that. We're working with the superintendent of the schools, and of course, he'll make that decision a lot of times based off of our recommendations. So we are in communication about that. But for right now, I say it's not, there's no evidence that it's in Beaufort County spreading around, and so I think that right now we are very low risk for the children there.
Thank you.